This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
So I guess Friday evening was supposed to be PEDS, is the idea. So it's kind of a little PEDS medical minute. So something we see commonly in adults, but don't see that much in children, is Bell's palsy or facial nerve palsies. It does happen in pediatric patients. We don't see it anywhere near as much as we do in adults. And some of the causes can be some of the same things. Sometimes it's viral, like a herpes virus. Sometimes it can be, in a Lyme endemic area, things like Lyme's disease. But there's some other causes, and one of the causes that I was not aware of until recently is a first presentation of an acute leukemia can present as a facial nerve palsy, Bell's palsy basically. And I'm not sure why that is, but it has been described kind of multiple times before. And there was an interesting study that was actually set out as a trial to see if the medications that we use in adults help for kids with Bell's palsy. So steroids and acyclovir. So it was a trial, and they were recruiting children with acute facial nerve palsy to see if they're, if they randomized them to either steroids and acyclovir or no treatment, if there was a benefit. And while they were doing this study, they did screening labs on patients, and they found that, out of 640 kids or so that they screened, 5 of them had an acute leukemia that was previously undiagnosed. So about 1%, which is not nothing. It's not like this 1 in a million thing. And not only could it potentially be good to diagnose an acute leukemia earlier on and, start someone getting treatment and testing they need for it, but the treatments for Bell's palsy, which include steroids, can potentially complicate the treatment of acute leukemia because it can sometimes mask or partially treat the leukemia and prevent the person from, finding out or getting diagnosed with it. Or it can induce tumor lysis syndrome in some situations. So it could potentially, make their undiagnosed leukemia a pretty dangerous acute situation. So the authors of this study actually kind of published an early study before they even, got to their actual trial of seeing what medications helped, to say, all right, here are these findings. About 1% of kids have acute leukemia when they have Bell's palsy, and maybe we should do just even a routine screening CBC on these kids. So it was something that I was not aware of. And then, if somebody sees a pediatric patient with facial nerve palsy, and we're saying, we don't know what this is, but, they have something in our back of our minds, say, hey, I've heard that this could be a presentation of acute leukemia. Maybe we should check them just to screen. So any questions, any thoughts? I personally have never seen a pediatric patient that I can remember with facial nerve palsy, so it's not that common, but it happens. Thanks, guys.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.